It's really a pleasure to be here and be talking with you guys. This is such a hot topic right now. Obviously, I wish I could meet all of you under different circumstances, but I've been in various different areas of healthcare. I've done everything from in-community work to those with HIV and AIDS. I've worked in hospitals. I'm a therapist. I also do administrative work, so I've kind of experienced a little bit of everything that healthcare has to offer. And whether you're administration, support staff, frontline workers, contact tracers, in my mind, all of those things are frontline workers, and we have all been impacted by this. Whether or not at some point you're listening to your staff or you're listening to your colleagues or you're kind of hearing the stories. We've been out there since the beginning of this and trying to cope. And at some point it gets to be overwhelming. And I really think, we've gotten to a point where all of us are just kind of over it. And how do we move on? So this presentation is really about reducing fear, coping with the stress of what's been going on, and focusing on bouncing back. Because I really think that this has been a little bit of a trauma for all of us, and we'll talk a little bit more about that later. If you want to start the next slide, Jean, that would be great. So again, pre-COVID, all of you, again, I consider healthcare workers to be anyone who works in the healthcare field. It doesn't necessarily have to be someone who's out in the field. It can be, but we all are experiencing high levels of stress, and we did even pre-COVID-19. So that we're always at risk for a higher rate of burnout and vicarious trauma and compassion fatigue. And those are kind of some buzzwords, and we'll get a little bit more into that later. So now you move into the post-COVID world, and now things have increased significantly for us. There's a huge disruption in our daily routine. Our workloads have changed. Your body is constantly in that fight or flight response. Lots of uncertainty about jobs, about what's going on with the kids in school. I mean, there are so many aspects of our lives that are being affected. Changing information, misinformation, lack of information. I mean, all of this can create increased anxiety. I know for me, my work shifts have kind of changed. Because I'm not in the office every day, I'm not out in the field every day, I've noticed on the days that I do work from home, I have a tendency to check my emails at 11 o'clock at night or 3 o'clock in the morning when I've popped up and I can't go to sleep. That can really impact how you physically and mentally feel. Social distancing, I know that people want to go out and spend time with each other and enjoy their lives. And the fact that we're not able to do that, not able to have that outlet has been really challenging. Not to mention, the health, the financial, and the travel anxiety. I have elderly parents that live in states that are under quarantine. I had plans to go meet with them, and that's some of my own self-care routines, spend time with my family, and I'm not able to do that. And not only is that, kind of a travel burden, it's a financial burden, but it's also lacking on self-care. And another buzzword that you've heard about, or hopefully will hear about during this presentation, is moral injury. So that's another thing as healthcare workers that we're more exposed to. Next slide. So how do we start to reduce our fears about COVID-19? I feel like, we've all gotten to a point of such frustration with the illness that we're starting to, turn our fear on each other. Instead against the disease itself and the situation itself. So, trying to release that anger in more healthy ways. I see people getting very short with each other, very angry, getting upset. I actually witnessed an interaction where someone asked for someone's phone number in effort to do contact tracing, and that person got really angry with the person who was asking. These are kind of things that we're faced with. And so how do we release that kind of fear and stress energy that we have based on everything that's going on? And I really think it just comes down to starting to practice kindness and acknowledge we are all sacrificing in this. Whether or not, again, you are a healthcare worker, whether or not you work at a grocery store, whatever your occupation is, we're all being affected in multiple ways and having to make accommodations, especially if you have children and other things and families and other things going on in your lives. And, I know for my organization, a lot of our workers actually did contract COVID-19 and they were impacted significantly by that. And how do you kind of move on and reduce the fear of exposing others and things like that? So just kind of acknowledging and practicing kindness is really important. Social connection. I mean, this is is a human quality that we all need in order to be successful in life. We need it to feel like a part of a group and a part of a collective well-being. But that's been really hard. We're isolated. We're distant. We're being asked to distance our bodies. But how do we not distance ourselves at heart? I know that sounds kind of cheesy, but how do we learn to reconnect emotionally with people when we're forced to be distant physically? Next slide. So I found this kind of in my research, and I thought it was a really kind of a fun way to kind of sum it up on what you can do to face COVID. Really focus on what's in your control. There are so many factors and things that are going on that are completely out of our control. And that, for me, is one of my biggest struggles because I'm a little bit of a type A personality and a little bit of a control freak. So then I start to find other things to control in my life if I find that, I'm feeling out of control in other areas. And this has really given me a very unique opportunity to stop and pause and think about things and say, take a moment and say, this is not in my control. Acknowledge your thoughts and feelings. I always tell my clients, thoughts and feelings aren't actions. And you are allowed to have thoughts and feelings. How you act on them, that's another story. So, be okay with how you're feeling and some of the thoughts and negative thoughts that you might be having about this situation. And come back into your body. A lot of, they talk a lot about mindfulness and meditation, but really sitting and thinking about how you feel. When I'm working with my clients, I talk a lot about, like, where are you feeling your anxiety? A lot of people talk about it, they're feeling it in their chest, or they feel it in their stomach, or they feel it in their head. It's really acknowledging where you're feeling it so you can kind of come back to the here, now, and present and engage in what you're doing. Really focus on one task at a time. And, having the committed action, saying, I've decided on this task, I'm going to complete it. And opening up to people, whether it's family and friends, whether it's a counselor, a therapist, talking to people, your supervisors, whoever it might be that can, help you kind of guide you through this. And, kind of deciding what your values are associated with this. I think a lot of our values have kind of shifted based on this whole pandemic. And it's been an interesting time. And identify what your resources are. We're going to talk a little bit about that later, about, what things can you do and things can you incorporate to keep yourself healthy. And also, as you guys know, disinfect. You're just going to, that's part of the thing that's going to make you feel a little bit more safe, So just try to remain distant and disinfect. Next slide. So when you talk about focusing on self-care, everybody talks about this, and it's very rarely practiced. And if you had a healthy self-care routine before COVID, I think COVID kind of threw a monkey wrench in that. And it made it even more difficult to do. Gyms closed. I know a lot of people find that as a healthy coping mechanism for anxiety and stress. Then they had to alter ways. So, how do you start to, reincorporate that now? How do you start to reincorporate healthy coping strategies? This is a very profound time in our lives, and it's no shame and no wonder that we've been completely disrupted and dysregulated as humans and as a society. And many people are experiencing these normal waves of anxiety, depression, and stress. Keep in mind that as a therapist, I teach others how to cope and manage with their stress and anxiety. And a few weeks ago, I just had this overwhelming feeling of isolation and anxiety and stress. And it really took me a little bit and a moment to kind of gather myself. So being okay with having understanding that you're going to have good days and bad days. And, you know, obviously this pandemic is rendering us more, you know, vulnerable to burnout and vicarious trauma and compassion fatigue. And that really just means that, you know, whether it's caring for our employees, whether it's caring for our patients, whether it's caring for our colleagues, friends, family, it comes to the point where we start to kind of absorb their trauma and what they're experiencing and their kind of negative feelings and negativity. So we're going to talk a little bit more about that because that can be really impactful. And understanding that, you know, this gives us an opportunity to be more resilient than ever, and really start to incorporate self-care into our lives. I think now more than ever, we're starting to see how important self-care is in keeping you kind of mentally fit and stable. Next slide. So I don't need to tell you guys what the symptoms of stress are. I mean, if you're feeling irritation, anger, denial, uncertainty, nervous, anxious, like a lack of motivation, trouble sleeping, that's a big tell for me. Feeling overwhelmed, sad, or burnt out. These are all symptoms of stress, and, you know, just something to keep in mind. Some stress can be healthy. Some stress can be debilitating. And again, we'll talk about that in a little bit later and how to change your mindset related to how you function during a stressful time. So obviously some common work-related stressors for all of you is the risk of being exposed, being out in the community, whether you go to the grocery store, you're going to work, whatever it may be, or the risk of that someone that in your family will get exposed and you will be, you know, have a secondary exposure. Taking care of your personal family needs while working in this environment, that has been such a huge struggle for me. You know, it's been a really difficult balance because you kind of feel so depleted at the end of the day that you're not really able to accomplish some of the tasks that you might have been able to do before this. And managing different types of workloads. Again, you know, I think a lot of emotional and physical burden has been put on us. And how do we manage that all during this stressful time? Next slide. So what is compassion fatigue? When I heard this word, I would say about 6 years ago, I said, uh-oh, this is another fluffy therapeutic term. But it really sums up what kind of happens to healthcare workers, mental health workers, anyone who's dealing with kind of traumatic situations. It is defined as the physical, emotional, spiritual depletion associated with caring for patients who are in significant emotional pain or physical distress. So basically, your body just kind of shuts down after dealing with this over a course of a long period of time. And what happens is that you start to lose your sense of empathy. And the truth is that we all went into this field to help people in one way or another, no matter what capacity of healthcare you work in. You know, whether it's, you know, helping nurses, you know, through difficult times, or it's helping, you know, other healthcare workers, whether you are a healthcare worker yourself and you're, you know, providing injections, contact tracing. We all did this because we had this kind of calling. And when you get to that point of compassion fatigue, that can be a kind of depleting feeling and defeating feeling. So, you know, how do you start to conceptualize this idea of burnout and vicarious trauma? And the good news about all of this is that you can bounce back and be resilient from having some of these feelings. Next slide. So the behaviors that are associated with compassion fatigue are like that running on empty, feeling like you have absolutely nothing more to give, extreme emotionality, distress, and apathy, which is kind of like the feeling of nothingness. It's just not feeling anything one way or another, or not caring. And that can sometimes be really hard for us as helping professionals because of the fact that that's kind of what we do. And getting to that point can sometimes be, again, a very defeating type feeling. Next slide. So what's vicarious trauma? This is something I think we are all going to hear more about. They also call it secondary trauma. It really just is defined as a repeated exposure to other people's trauma. You know, when I'm sitting and dealing with a client that suffered a very significant trauma, no matter what it is, when I'm talking to a colleague that experienced COVID and you know, had some challenges with that, and then what led up to that, that leaves an imprint on me. I truly believe that every human we come into contact leaves an imprint on you. And that's kind of what this is. And that it's a kind of a cumulative effect that over the course of time of dealing with some of these negative things that happen in our society, or, you know, someone always says, oh, well, I'm always the friend that everyone comes to when something's gone wrong. Well, at some point you're going to start to absorb that, and it becomes a mental and physical, you know, thing that just kind of will start to impact all areas of your life if you're not able to find a healthy way to deal with it. Next slide. So what happens eventually is if you start to feeling compassion fatigue, you start to have some, you know, some vicarious trauma, what eventually will happen is that it will lead to burnout. And it is a long-term stress reaction. Burnout just doesn't happen overnight. You know, people say, oh, I'm so burnt out. Well, what does that mean? It's really marked by emotional exhaustion, depersonalization, which is kind of like, it's a fancy psychiatric term. And it just kind of means feeling like you're outside of your own body, like you're kind of walking around in the world as like a zombie, not really remembering what you do day to day, and feeling like, you know, a lack of sense of personal accomplishment. Next slide. So some of the emotional signs of burnout, and what I really like about these slides, and again, I want to kind of reinforce that we want to focus on resiliency, but one of the feedback that I've gotten from having this presentation and doing it quite a few times is that I don't like labels. I don't like diagnoses. I think sometimes it can be a debilitating thing. But in this case, I really feel that sometimes we need to name how we're feeling right now, and that so many people are feeling that way that they actually came up with a name to describe what it is. So what is emotional signs of burnout? It's depression, cynicism, anxiety, decreased compassion for others, numbing, like just an emotional sense of numbing, you know, a disconnection, helplessness, hopelessness, you know, a decreased sense of self, exhaustion, confusion, boredom. These are all things that kind of are tied in with the emotional aspects of burnout. Next slide. So stress and burnout can cause physical symptoms and signs. I will be the first one to tell you when I'm experiencing a stress reaction: headaches, muscle aches, back pains, and muscle twitches. I get this left eye twitch that is a tell that I have stress. And a lot of people get, you know, gastrointestinal distress, and that's a very common, you know, sign that, you know, you may be experiencing some sort of burnout. Any of you who've ever had anxiety, sometimes it feels like your heart's going to pop out of your chest. Heart palpitations, you know, obesity and overeating, memory difficulties, frequent colds, heart disease. These are all things that can happen as a form of a stress reaction and burnout. Next slide. So what are some behavioral signs that start happening when you start to feel like this? Again, insomnia. You start to, you know, have these kind of blurred boundaries or overly rigid boundaries. Boundaries are a wonderful thing. They really help us kind of create a healthy bubble. I call it a healthy bubble around you to let the good stuff in and keep the bad stuff out. But people who are having behavioral signs of burnout really have no concept of that. So something to keep in mind. You know, you can't be everything to everyone all the time, and it's something we do talk about in a later slide. Avoiding all kinds of things, whether it's work, obligations, family, you know, family get-togethers as much as we do, whatever, avoidance of emotions, of feelings, insomnia, starting to become overly judgmental, you know, being hypervigilant. I know that I'm stressed out. Someone comes up behind me and it just startles me for really no reason. That could be a sign of stress. starting to use unhealthy distractions. We saw this a lot, during COVID. We weren't able to do our healthy distractions, so people turned to shopping and eating and online gambling and things like that. That became an unhealthy distraction. Isolation and substance abuse. I think a lot of people, we all saw those memes on social media about that it became socially acceptable to show up to a Zoom meeting intoxicated. Obviously that is not socially acceptable, but the meme was actually a sign of how society was feeling at that time. Next slide. So what is moral injury? Again, when I heard this word, probably about a year ago, I was like, uh-oh, again, another little fluffy psychiatric word we came up with, but it really means something. And it really is the distressing psychological, behavioral, social, or spiritual pain that results from being put in a traumatic situation where one has to behave in a way or witness behaviors that go against their values or moral beliefs. To sum it all up, let's give an example, and I really, really like this example. As a healthcare worker, going into homes versus, and knowing the risks of being a healthcare worker, and then witnessing unsafe practices in patients' homes and communities during COVID. So then you are forced to make a choice of your duty and your oath as a nurse, and your value of, I have to care for this patient, but they're not practicing safely, and having to choose, do I do my job, or do I keep my family safe? So again, you can put in whatever context that you want, but it really affects you and your outlook on life. They termed it a moral injury. And again, I have experienced this in my own life, in my career. And it was really nice to hear and give it a name, that we want to help clients. We want to do our best to service them in some ways, but sometimes we're, going outside of our scope or doing things that are against what, the CDC recommendations are, can be really challenging. So again, I really like this, is that, sometimes you're reliant on other people to be safe. Just another quick example, we have a group of clients that we work with that are coming into our offices to receive injections and things like that. And we ask them all those tracing questions and screening questions about whether they've been out of state, and we knew for a fact that some of them were lying and not telling us the truth. So we're kind of being put in a situation like, do we continue to treat this person like we're supposed to, or are we, do we turn them away and force them to self-quarantine? And where they might end up in the hospital or have a psychotic episode. So it's a really challenging time. Next slide. So if you're starting to notice any red flags, like less patience, difficulty maintaining your empathy level, increased advice giving or telling or demanding, you're not really listening, you're just kind of, forcefully feeding your opinion. If you get to the point where you're really excited when meetings get canceled, everyone gets excited when meetings get canceled here and there. But if you're starting to look for those days where you have a lot of no-shows and a lot of cancellations, that might be a red flag that you're getting to the point of burnout. Next slide. So why is it important to support each other? Offering support to employees and our coworkers and our colleagues during this time, why do we want to do this? It's because it reduces burnout, it reduces turnover, and as we know, turnover is so challenging for an organization financially. It's challenging, personally. I think we all want to take care of our employees. We always want people to have a good experience in their working environment, but also support. When you feel like you have a supportive person, whether it's a supportive colleague or a supportive, supervisor, it really increases your productivity and your motivation, your loyalty, and your effectiveness in your job. Next slide. So what can we do? What can we do for each other? What can we do for ourselves? And what can we do to support, each other in this whole process? Showing empathy, again, is huge. you know, there's a difference between empathy and sympathy. Empathy is really putting yourself in somebody else's shoes and understanding, trying to understand their personal experience. Sympathy is really just feeling bad for somebody, and feeling bad for somebody's, you know, circumstances. So really trying to understand where each person is coming from and why they're having the anxieties that they're having. And communicate with people about how you're feeling. Communicate with your supervisors, communicate with your EAP program, communicate with your therapist, your, you know, your family, your support system. You know, be open about some of the struggles that you're experiencing, you know, and try to have more inclusion decision making. I think at this time, people are kind of just bombarded with all this stimuli that decision making has become really challenging. So kind of including your network or your support system into that decision making, or incorporating your team into that is really important. And recognition. This has been a really hard time. You know, I think I'm a doer. I'm a walker. I'm out of my office and I'm checking in with clients, and I'm in other people's offices and checking in. That has been really hard to do, and say, hey, you're doing a really good job. But I think, you know, sometimes in the, you know, with social distancing, wearing masks and having to, you know, have designated bathrooms and things like that that we're doing out in the community, I think some of the recognition is getting lost. Making sure we are taking the time to recognize when someone's doing a good job and recognizing when we're doing a good job. I think we're so easy to give other people a pass, and sometimes it's very difficult for us to give ourselves a pass. You know, and seeking supportive supervision and consultation is really, really important. And, you know, how do we reorient people back into the office? For those of you who've been continuing to work out in the field, you know, that's wonderful. I look to you to help me, you know, teach me how to reorient me back into the office, because it is a little bit nerve-wracking. I'm starting to go in a little bit more each day. And that's been challenging. People are having a lot of anxiety about that. And being supportive during that time. And strategizing how we can work more efficiently and effectively. I am easily distracted in my home. I'm surprised one of my cats hasn't come up behind me. You know, I'm easily getting sometimes distracted, even on a day-to-day with everything going on. So how do we kind of focus and work more efficiently? And we have to integrate self-care in our lives and role model it. You know, I do this with my clients all the time. I'll sit with them, I'll do some deep breathing with them in the first 10 minutes of the session. So they say, hey, listen, you know, I'm not just preaching it, I do it, let's do it together. So that can sometimes really be helpful in a way to support each other. Next slide. So resiliency, how is it defined? You know, I think in the healthcare world and you know, in employment, I think sometimes, you know, I remember when I was a younger adult, I worked in the retail business, and that, like, the things that we would joke and laugh about after our shift about, you know, the woman that stole a table full of underwear, or, you know, the person that was, you know, trying on things, whatever it was. You know, we had to laugh about that because like, these things made jobs stressful. Well, our jobs are really, really stressful, and starting to find, you know, ways to rely on humor and kind of in a healthy way, and bring back the fun of the work that we do. Being more optimistic, you know, learning a new skill. And again, resiliency doesn't necessarily, you know, it can be learned. If you don't feel it now, it doesn't mean you won't have it. And I absolutely love this quote by Nelson Mandela that talks about the greatest glory in living lies not in never falling, but in rising in every time we fall. So we've fallen right now, and now how are we going to focus on the important task of rising? Next slide. So really, I talked about mindset a little bit earlier. What's really, really key with this is that the non-resilience mindset is stress is debilitating. And if you have that idea, it can be debilitating, but what are you going to do with it? So if you're of the mindset that stress is debilitating, and that, you know, what's going to happen is that you are going to be at greater risk for burnout and this trauma and compassion fatigue. And it can lead to withdrawal and ruminating and self-criticism and avoidant behaviors. But what we're trying to do is we're trying to move to more of that resilience building idea that stress is motivating. I don't know how many of you have ever had anxiety. I haven't. Sometimes it can be really challenging, especially at 3 a.m. But I will say my healthy anxiety has helped me achieve goals, meet deadlines, excel in my career. And that's kind of the way that we need to look at this. Not everything has to be debilitating. That, you know, anxiety or stress can be motivating. And if you start to have that mindset that I'm going to make this situation make me grow as a human, and make me grow as a professional, you're going to have less depression, increased energy levels, decreased anxiety, better work performance, and you're going to start to focus on problem solving and setting goals instead of kind of getting stuck, which is where the idea of, you know, the stress is debilitating is. Trying to move forward is resilience as opposed to being stuck in a non-resilience mindset. Next slide. So we talked about a little bit about this earlier about healthy boundaries. Well, one thing that there's many things that we can do for ourselves, but one of the main things that I realized during this pandemic, and again, I always like to use myself as an example because as a trained therapist, we sometimes have our slips and falls as well. Wellness and happiness are inside jobs. I noticed myself that I got obsessed with online shopping because I didn't want to go into the grocery store. But what ended up happening is it started to branch out into Old Navy and Macy's. And, you know, that shirt didn't bring me the joy that I thought it would. Or, you know, that hamburger and that French fries did not bring me the joy that I thought it was, because the truth is that a lot of times when we're stuck in this very stressful feeling, we're looking for outside sources to fill these voids that we have in ourselves. So really focusing that happiness is an inside job is really an important thing. Make sure you're flexible. Try to be accommodating, but do not try to be everything to everyone all the time. I've had to do this. I especially do this with my husband. You know, there'll be sometimes he'll want to go out and do something. And I've said, you know what, I would love to go ahead, go for that walk down to the beach. But I think my self-care is I'm going to, you know, take some deep breaths, take a bath and be okay to do that. And if you don't feel comfortable, I had to turn down some obligations, like, you know, of people who were getting married and they were doing socially distant parties. I had to turn down those obligations because I just didn't feel like I was safe. And I also felt emotionally depleted to do it. So you got to maintain those boundaries and set realistic expectations. Also, accept your own limitations. We are not super people. We can't do everything all the time. And understand that everyone has the right to make their own choices. Next slide. So really, what can we do is, like during this time, is start to re-engage in some of those good physical, emotional, and intellectual, spiritually healthy practices that we had before COVID. Try to be more creative. Please reduce your news and social media. So not only do we have COVID coming on, we have an election coming up, election year, and there's so much negativity on all sides. You know, try to limit that intake, but stay informed. Distract and redirect. Exercise. You know, keeping your immune system healthy will help you combat all the symptoms of burnout. You know, get out in nature. You know, it's a little bit hot right now, but September is awesome in this area. So, you know, make sure you get out and enjoy the fresh air. Try to practice some mindfulness and meditation, and make sure you stay connected with others. Next slide. So again, if you've really started to have all of these things, don't be afraid to ask for help. There comes a time where all of us need that extra help. You know, if you've tried to incorporate a lot of the self-care things that we've discussed and you're still not feeling it, you know, ask for help, seek mental health care. You know, VNA has a wonderful EAP program. CPC Behavioral Health is available. If you want to see a therapist or need to, feel like medication might be an option for you. Because the truth is that this has been a trauma for all of us. And if you've had to experience traumas in the past, this has really probably brought up a lot of those feelings. So don't be ashamed. Don't feel like there's a stigma attached. I feel like people in the healthcare world, people think we're supposed to be, again, super people. We're humans, and we should be able to kind of process this just like any other human would. Next slide. So again, we really want to focus on, changing your mindset, your perspective, setting, personal expectations for yourself, and, reconnecting to the larger purpose in life. The truth is that, we're living history. People are going to be talking about this for a long time. And, how do we make the best out of this situation? And, it really comes down to, how do we move forward and how do we take care of ourselves? Next slide. So these are some of the apps that I actually have used. I actually have worked with my clients sometimes to use them, and I really think they've been really helpful. Calm is one of my favorite ones. All of these offer free content. Some of the more premium content you have to pay for. I know for Calm, if you are a healthcare provider, a lot of these apps will actually offer you a free year of premium content. So that's something to look into. I know Amex offers, American Express offers a discount for Calm, but all of these, Insight Timer is completely free. And it's really nice to be able to try to use these to help with stress and anxiety, because it's not self-indulgent to do this. At this point in time, it really is about self-preservation. So like I said, these apps I really like, and play around with them. See what you like, see what you don't. A lot of them have all kinds of different things, something to help you meditate, something to help you sleep, something for calming, something for anxiety, something for when you're feeling sad. Some of them will have some moving meditations. So whatever kind of, you gravitate towards.